Hello, I'm Dr. Hassan Tawheed once again with a very powerful topic. What if my topic has already been taken? What if my topic has already been taken? This is one of the most commonly asked questions. And if you are a research mentor, if you are a professor, you must have seen this kind of challenge, this kind of question coming from your students. If you are a student, you must have felt this, and possibly you are currently going through the same situation. That what if my topic has already been taken? Remember, if you're working on any study design, if it's a clinical trial, if it's an observational study, if it's a case study, and somebody has already done it, so now should you do it or should you not do it? If it's a clinical trial, it's okay to do it. The more data, the more patients we will have, it will be helpful for the future scientists. They will see your paper and they will combine other people's papers and they will have a bigger data of patients. So it's a good thing to have a topic that has already been taken for a clinical trial. And for observational studies, whether it's cohort study, whether it's a case control study, or whether it's a cross-sectional study, or even if it's a case study or case series, it's a good topic to have. If you have selected the same topic that somebody else had selected before, it's okay. It will just complement their effort because you will have additional patients in your study, and the future scientists will get a great help because of your paper. If they are working on a systematic review or meta-analysis, your paper will help them tremendously because you will give them more patient data with another location possibly, with another population possibly, or maybe the same population. So don't get disappointed that why I have selected the same topic. It's a good thing to have. Now, what about systematic review or meta-analysis or a traditional review or simply a literature review article? If you are planning to write a systematic review and somebody has already written a topic related to that, now what do you do? Now remember, if somebody has published the same paper this year, a few months ago, now you are working on the same paper and no other paper has been published before, then it is not a smart thing to do to write the same systematic review again, because you are going to get the exact same results, more or less, unless they had made a mistake. So what do? Look at, is this article published this year? If yes, stay away from it, ideally. But if it has been published 2 years ago, then there will be a lot of studies in between. Now, this is a very good topic to conduct a systematic review. You include their studies and you include other studies that have been published in the last 2 years. Although last 1 year is also good. If there is no article published, no systematic review published on the same topic before, since last year, let's say today is 2022 June, and you have an article, a systematic review published exactly the same topic, 2021 June or July, then should you work on it? See how many papers are published related to that, how many clinical trials, how many observational studies are related to that, published after 2021 June or July. If there are like 5, 6, maybe 10 studies, that means you have plenty of studies to add and expand the findings of the previous systematic review. So you can write a better systematic review, an updated version of systematic review related to the same topic, or you can just focus on last 1 year of studies and still write a systematic review. The systematic review that was published by other scientists last year, their paper has studies up till 2021. Your paper will have studies published after July 2021 to 2022 July or June. So I hope I have made this point pretty clear, that it's okay to have a similar topic. Ideally, the best thing would be if no systematic review or traditional review has been done in last 2 years on the same topic. Then that's a wonderful thing for you. But make sure there are some clinical trials or observational studies or some case studies done during this time in these last 2 years, since June, July 2020. If there are plenty of studies, if you find 5, 10, 20, 30, 40, that's better, that's wonderful. You can just focus on last 5 years. So that's not a big deal. You can just focus on last 2 years, or you can just focus on last 5 years. So your paper will still have new studies published in last 2 years, from 2020 to 2022. And you will also have studies published before 2020 to 2017. They will be more or less the same studies that were included in that previous paper, but it's okay, now you have some additional studies. So yes, you can focus on last 5 years because you will have new studies of last 2 years. Or if you want to be more precise, then just focus on last 2 years as your inclusion criteria, and you can do a systematic review. Yes, you can. So don't worry about it, that if you have an idea, a very good idea, you love the idea, but somebody has already done a systematic review or meta-analysis on the topic. Just see, when was it done? If it was done this year, a few months back, and no new clinical trials or studies have been published lately on similar topic, then you cannot add any studies. You cannot do anything. This is a situation where you are stuck. You cannot do it. But if it was published last year or 2 years ideally, then that's a perfect time. Now look at the search engines, the databases, and see how many clinical trials and observational studies have been published related to the same topic. If there are plenty of them, 5 plus, 10, 20, that's wonderful. You can write a systematic review. So yes, you can. Same with meta-analysis, same with the traditional review. So now I'll repeat the question again and repeat the things we learned in this video. That if somebody has selected the same topic as yours, what do you do? So if you're working on a systematic review, see if there is a systematic review published on the similar topic last year or this year, or published in 2020 or 2 years ago, and see if there is any study, any clinical trial, because you will be adding clinical trials and observational studies in your systematic review if you're working on a same topic, right? So you have to see, okay, systematic review, you have a systematic review, for example, smoking and Parkinson's disease. Now you see that another systematic review was published last year or 2020. Now you have to see how many clinical trials are published or observational studies are published between this time or during this time, so that now you have some papers to add in this systematic review. So yes, it's okay to choose the same topic. It's okay. As long as there was no systematic review published in last 2 years or 1 year, and between this gap or during this gap, you had a lot of studies, a lot of clinical trials and observational studies conducted, because you will be adding clinical trials and observational studies. Remember, we're talking about if you're looking at writing a systematic review and a systematic review was done previous year or 2 years ago, then it's a good topic if there are some other studies in between. But if you are writing a systematic review and a systematic review on the same topic is done last month, then there is no other studies possibly on the same topic. Then, or maybe 1 or 2 studies have published recently. So you can't do it. So the best approach is avoid that topic. Choose the topic and stick with it if it was published last year and there were studies published after it, or 2 years ago and there were studies published after it. And now for clinical trials, if you have chosen the same topic that other people had done recently or previously, it's okay. It's a very good thing to do because you are helping the future scientists. So if it's an empirical study, that's a very good thing. If you have the same topic, you are giving more patient data for the future scientists to write a wonderful systematic review or meta-analysis. But if it's a systematic review and meta-analysis, see when was the systematic review related to the same topic published. If it's published same year, avoid it. If last year or 2 years ago, that's wonderful. If other studies are published in between, other study designs. I hope I have explained this concept very well. And if you have any question, please comment below. I'll get back to you as soon as I can. And thank you for watching this video. Keep learning, keep watching.